What if I told you there was a disease that from birth would cause tremendous pain, strokes, joint replacements, and ultimately, even death? The average patient only survives to around 45 years old. Worse still, we don't have a consistent cure to fix it. I'm Dr. Adam Goodcoff, and today I'm going to explain what sickle cell anemia is and why it's killing tens of thousands each year. To understand sickle cell anemia, we first have to look at how red blood cells function. Think of the red cells as trucks on a highway, carrying this cargo of oxygen. Early in a red cell's journey in the large arteries of the body, it feels much like an 8-lane highway. There's plenty of space. Here, the cells are relatively tiny compared to the large passageways, and flow is never a problem. Just like in cities, the largest highways are in the main areas, but an infrastructure of smaller streets is needed to connect cars to all the homes. A similar system is in our body. If the arteries are the highways, then the arterioles are the surface streets, and the capillaries are the small driveways to each person's home. Red blood cells have a special property, being that they are somewhat flexible. When cells travel from arterioles into the small capillaries, which measure only 8 micrometers in size, they must not only go single file, but sometimes they literally need to squeeze through. Once out the other side, they can exhale and go back to their normal biconcave donut shape. So what does this have to do with sickle cell anemia? To get really nerdy, sickle cell anemia is a disease of a single amino acid mutation. You'll get cells which, under stress or at low oxygen levels, are more likely to lose that nice, round, donut-like or biconcave shape, and begin to start to have dysfunction. Things like sticking together and not being able to squeeze in like a normal red cell. Not only are the sickled form of these cells not flexible enough to pass through the small capillaries, but they also stick to each other, making larger clumps. These clumps, known as clots, are problematic. They wreak havoc across the body. This means areas of the body hurt a lot because there is no blood flow getting to them, or at least very limited flow. This means strokes, joint replacements, and ultimately, even death. Sadly, as I mentioned, we don't have a cure. Actually, I wasn't 100% truthful with that. First off, we have reactive treatments. This often consists of strong opiate medications, with doses 3 to 4 times larger than the average dose given in the emergency department. We also have a therapy known as exchange transfusion. This is the removal of a patient's blood, but instead of cleaning it and putting it back, this time it is exchanged for entirely new blood without sickled cells. The best thing we have now are stem cell transplants. What if there was a way to give a patient a fresh start by putting in new bone marrow that knows how to make regular red cells that don't have the ability to sickle? Unfortunately, this is not as straightforward as it might sound. In fact, it's not straightforward at all, and it's actually quite high risk, especially for things like rejection of this new bone marrow, which could make the patient even more sick. What was once a protective mechanism is now an obsolete mutation, killing tens of thousands each year. If you'd like to learn more about sickle cell disease, the research currently ongoing, or how you can help, visit the link down below. Be sure to like this video and let me know in the comments what you would like to see next. And don't forget to subscribe to have your health explained.